Hope everyone's doing well today. Today we're going to be discussing a topic that is a pretty serious one that needs to be addressed just a little bit more than it is, because there aren't any treatments yet that have been approved for it, and that is PSSD, which is essentially post-SSRI dysfunction. Now with this, what this entails obviously then would be somebody who's been taking SSRIs, and it can be really any amount of time. I would say anywhere from even a couple months to when they start taking effect to years down the line. This hasn't really been popping up much in the medical literature at all, but with a lot of people, and what I mean by a lot of people, with people who have depression, SSRIs are a very common and first-line medication that is prescribed. Things such as Zoloft, Prozac, and even too, not just SSRIs for PSSD, but also it has been shown that SNRIs can cause some of this as well. So when somebody stops, men or women can have different problems when it comes to, sex in general. With men, it can be anywhere from not being able to get an erection to maintaining an erection to also even things such as being able to get an erection but not really being able to feel it. There's no feeling sensation with it, to where there's no pleasure with it as well. Women can have problems as well with things such as lubrication, in particular lubrication issues, for preparing for sex and even during sex. Common issues. And with this, there are some key questions that I think at least should be addressed a little bit more. And in particular, these are things that FDA in general, there needs to be more studies for. So the first question and the first aspect of this that I think is the most important is when you stop taking the medication, assuming, and once again for this condition, it's after you get off of the antidepressant, or as well as when tapering. When did you start noticing the problem? And I have had this is a common question in the psychiatric setting. One reason a lot of times patients don't want to start antidepressants is due to potential sexual dysfunction. And one of the common problems with this when somebody's trying to get off of an SSRI or SSNRI an SNRI is potential sexual dysfunction. So meaning they don't want to take it at the beginning because they're worried about having sexual problems, but also sexual dysfunction problems, but also sometimes with it, while they're on it, they might notice a little bit of when they first start having some sexual dysfunction changes, but they adapt to it. But then they start lowering the dose when they're trying to get off of it over time, and they start to notice it's a rebound effect to where it can be it can be hard for some people to get off of it. And that's why in particular, the first question is, if this is going on, did you taper off the medication? Because if you cold turkeyed off it, that it can happen. It's still, if you read the few studies and information you do have, a lot of the information claims that it's a very, very small class of individuals that actually have this concern. But even outside of PSSD, the big thing I would say is when you're going off of them in general, you're going to have sexual dysfunction problems at first, which are going to cause sometimes even more mental health mood swings. But if you are suffering from this, how are you tapering? Are you going cold turkey? That's a huge aspect, I believe, as well to this. And it's one thing that patients have a lot of problems with when they're talking to their doctors about this as well, in regards to either starting it or getting off of it. Another aspect of this condition, are you taking any medications with yes, that's the condition, but as it continues to be studied, they're definitely going to find more aspects with it, meaning, are you taking another type of depressant with the SSRI? Are you taking a downer with it, meaning, are you taking maybe a benzo? Are you taking something for sleep at night? All these factors a lot of times can provide a whole holistic picture in regards to why you might be having some of the sexual dysfunction problems. So always make sure when you're talking to your doctor, your provider, if you're looking for answers, you always have to start, like if you're wanting an answer, you always have to start with yourself. You need to assess your own situation before you start telling, you go to a doctor and you're like, this is what's happening. Because a lot of times doctors, a lot of times with doctors, things go through the cracks pretty easily, things like this. So make sure you have a list. If you are taking any other medications, make sure you have that as well, because if you're taking something else that is a potential downer, that can cause some issues as well. Now, the third thing I will say that's really important is diet and hydration. And I know, I'm sure you've looked this up and heard about this before, but this is one factor that as well is neglected more than people think. Things such as water. Like, for example, do you know how many cups of water you're supposed to have a day? What about, depending on if you're exercising, it goes up as well. You need to have more than 8 to 10 glasses a day. Some medications dehydrate you. A lot of times even antidepressants can cause really bad dry mouth. A lot of times they can even cause dehydration, not overhydration. Also, just with any other medications you're taking, there are a lot of different balances to where, that's why I say you need to make sure you're taking in your information on everything you're taking. External factors as well play a role in your diet. Are you consuming a lot of sugar? Sugar has been shown for people, obviously it's a dopamine rush, it's a hit. So if you're taking in a lot of sugar, over time, if you cut your sugar down, you'll notice with that as well that you won't feel good. You're used to that psychological pull. But with that, if you're taking SSRIs, which in this case, if you're having problems getting off of SSRIs and you're having sexual dysfunction, look at the amount of sugar you're taking in. And I'm not saying cut all of it at once, because that can cause more problems, but try to lower it. So when it comes to protein and carbs as well, fruits and vegetables, very important. I won't go too deep into that. I'm sure you've heard that before. It's you can fast forward through this part if you want. That's just the diet part that's very important to always take into consideration. Now here's the fourth part. Sometimes I have noticed, at least, that there are, as I said earlier, SSRIs, but SNRIs, so meaning things such as, Wellbutrin or even Cymbalta. With this condition, regarding sexual dysfunction, what it shows is Wellbutrin could be a potential treatment. However, SNRIs can cause sexual dysfunction as well. And I was reading through forums and whatnot, because you should look through them as well. There are actually a good amount of people that have taken Wellbutrin who report having this condition after, and they're not regaining their sexual function back. So I would actually lump with SSRIs, SNRIs in there. So talk to your doctor, and they might try to be like, well, let's move from an SSRI to an SNRI, which is not a bad idea. Don't get me wrong. You should try that, but don't get discouraged if you notice that the SNRI is not working, because it's happening with all the different, right now, multiple different classes and types of antidepressants, not just SSRIs. So Wellbutrin and then Cymbalta, another SNRI. It's an atypical antidepressant. You'll notice the key a lot of times when it comes to sexual dysfunction, it's downers in general that can cause just generalized problems in general, in particular sexual dysfunctions, tiredness, grogginess. So don't get discouraged with that, because it's not just SSRIs. So always when it comes to medications, I would go with, if they're trying to switch you, I would go with the switch in regards to, this would just be me, I'm not giving medical advice, but if they're wanting to switch medications or tweak them a little bit, I think that would be a good idea, because some people might react a little bit differently. But then from there, if it's still going on, don't don't think don't think you're that extreme case, because there are cases on forums and whatnot where this is happening to plenty more people than what they're saying, and all of people who take antidepressants, like 0.4% of the population. I believe there's a lot more, because as the internet becomes more just increased to more data and information, I believe it's a lot more than that. And also, there's still a stigma with sexual health in general, or sexual dysfunction, when it comes to medication and psych meds. So I just want you to know you're not alone with this. And being an RN in the psychiatric setting, this is one of the most frequent questions that comes up, is antidepressants and sexual dysfunction. And there have been a few I that have talked about before, after taking them, having a lot of problems for 6 months to a year of not regaining their sexual health completely back. And I'm not trying to persuade anyone not to take them. SSRIs work wonders for people. I'm just saying, if you're currently going through this and you're having a sexual problem, and you were taking an SSRI, and then you're off of them, this could be the reason. So you might consider going back on it if you weren't having problems with it in the first place. So just throwing that out there. And then finally, there is one promising treatment, and I've talked about this even for people who have even specific types of drug addiction, even though it hasn't yet been approved, and probably won't be for a while. But there was a study back done a long time ago, from 1995 and in 2014, discussing after antidepressant use, or SSRI use, sexual dysfunction, and a treatment was very low dose dextroamphetamine, which would be like an instant release Adderall that you could take 5 milligrams daily or as needed. And essentially what it showed was, it did start showing improvements in sexual dysfunction and in sexual dysfunction in general. And also what it showed was, over time, so when they were taking the medication, they could take it as needed, being an instant release, or they could take it daily, that it increased not only their confidence, it also, when you're taking something even for ADHD, like an Adderall, it helps assist with your dopamine production in the brain, to where that's shown when it comes to sex and sexual desire, to be a very key component, to where it could also potentially help balance some of your serotonin as well, because they don't know the exact cause yet of what is causing the sexual dysfunction from SSRIs, but it is starting to be shown that dopamine agents could potentially help. So amphetamines are something, or dextroamphetamines in particular, the instant releases, have been shown to show some promise. In the studies, there were over 80% of the people that were in it showed essentially, over not only just like a couple weeks, but over a couple of months, and it didn't occur right away, them getting their sexual function back. Happened over a couple months, them regaining the confidence and being able to actually even have sexual desire again. So just know it's a process. It's not something that happens overnight, and it's going to you're going to have to assess everything you're taking in, because as humans, sex is important. We're human. We're meant to reproduce. So just keep all that in mind. I wanted to hit on this because it's something that's not talked about enough, but I want you to know that you're not alone. Tell your doctor about this. Talk to others you feel comfortable with about this, because what the internet will tell you is there aren't many cases, but there are a lot more than I would even have thought. But it makes sense, because more people have access to the internet, and just in general, there's starting to become more awareness with mental health, but there's still that stigma there. But just talk to somebody about it. Even just talking to somebody about it, because if you're having problems, sexual dysfunction problems, it can mess with you psychologically, and it leads to just lack of confidence as well, to where getting this addressed at any point, it's going to help you, talking to somebody about it as well. That is your daily dose of mental health. Please like, subscribe, comment if you feel comfortable leaving a comment. But let me know if you've taken SSRIs and you've had any problems in general. But yeah, that is your daily dose of mental health. I'll have a new video out probably, 3 to 4 days again. But check out all my other videos. I cover all things SSRIs, all conditions, medications, anything related to mental health, and I have a vlog as well. So have a great rest of the week.